Yeah, I'm brain farting. What's the name of it? Oh, is that how I do it? Right. Yeah, chemo brain. Blaming it on the chemo brain. Hi, so I thought I would talk about what you can expect when you are going in to get chemotherapy. So every time that I went in to get chemo, the very first thing that I would do is I would get my labs drawn. And the very first time that I went to get chemo, I had not gotten my port placed. So the first time I did have to get poked, and I was pretty used to that anyway. I don't know, I've gotten my labs drawn many times before, so it's not anything different. If you have a port, they just put a needle in the port. So when they're putting in the needle, it doesn't really hurt, and I'll go into more detail about this in another video, but basically there's this lidocaine cream that I was prescribed that I would put on an hour before going in to get my labs, and it doesn't numb you completely, but I would say maybe like 70%. So they leave the needle in there, and then there's a little tube that will come out, and they put a little cap at the end of that tube. You let the tube kind of come, if I was wearing this shirt, they would have the tube coming out this way. That way, by the time you go to get chemo, the nurse doesn't need to poke you again. They just use that tube to administer your chemo. And you only have to get poked once when you have a port. So the reason why you get your labs drawn is that every single time you get chemo, based on your lab work, your dosage of the chemotherapy or a targeted therapy that you may be getting may be different each time you get it, depending on what your lab work shows that day. And the main things that they're checking for when they draw your labs are your white blood cell count, your red blood cell count, your hemoglobin, your platelet count, and your bilirubin enzymes. And my understanding is that if you're outside any of the parameters of what you should be with any of those things, you may not get your chemo that day. And then I think it was about every 3 visits, they also did a urinalysis. So I would give a urine sample, and I believe the only thing that they were checking for with the urine sample is my HCG, which is a pregnancy hormone. So as far as I know, that's the only thing that I was checking for. Also, about every 3 times that I would go in, I would see my oncologist, and my oncologist would do a breast exam and just talk to me about any symptoms that I might be experiencing, any concerns that I might have. Then I would go to get my chemo, and the nurse would get my weight, my blood pressure, and ask me about any symptoms or side effects that I might be experiencing. They would ask every single time what medications I was taking at home, and I think that was pretty much it. And then I would either go to a private room, or I would go to what's called a pod, where they would have 4 chairs total. It was kind of like a big square with a chair in each corner, and they would have curtain dividers to provide a little more privacy, and there would be either 1 to 2 nurses per pod. And usually when the nurse would be asking me questions about side effects, or if I would have any questions, it was kind of hard sometimes because I would want to ask maybe a question that's a little embarrassing, and I have to just kind of be okay with the fact that other people might hear me. But really, people were very respectful of my privacy, but that's just one little con about being in a pod, is that there's just that lack of privacy. So then the nurse would always offer to get me a blanket or a pillow, and then they would also make sure that you would know where your call light was. So the call light, it was basically just this wire with a button at the end of it. So if there was an emergency and the nurse wasn't right there, I could press it, and then a tone would be set off on these speakerphones. The thing about the call light button is that there was only 1 tone, and that tone just means it's an emergency. So if you ever couldn't get a hold of your nurse for some reason, if they just weren't in the room or you didn't know where they were, the only way to get their attention would be to press the call light button. So the first time that I went in for chemo, I actually pressed that button because I just wanted to go to the bathroom, and I couldn't untangle myself from the IV pole. So I pressed the call light button, and this poor nurse came running in when she was clearly out of breath and asked me, "What's wrong? What's happening?" And I was like, I'm so sorry, I'm fine, I just have to go to the bathroom and I can't figure out this IV pole. But yeah, it might be different in other places, but that's how it was at the cancer center that I go to. So then I would be given 3 medications, which involve Benadryl, a steroid, and Pepsid. And then they would have me wait for half an hour, and then they would start to administer the chemo and then my targeted therapies as well. And for me, the amount of time that I was there would vary depending on if I was just going in to get the chemo or if I was going in to get the chemo and the 2 targeted therapies that I would also receive every 3 weeks. So on the days that I was just going in to get chemo, I would usually be at the cancer center for about 3.5 hours, and then on the days that I would get the chemo and the Herceptin and Perjeta, I would be there for more like 4.5 hours. The Benadryl would always make me sleepy, but if I really wanted to, I could push through it, or I could just take a nap. And then whenever I was done, that's when the nurse would take out the needle from the port, and it does hurt a little bit, but it felt more like a pinch. And the nurses were all really, really nice, very willing to answer questions, and if they didn't know the answers to my questions, they would go find a way to get those questions answered, or at least send off a message to the oncologist. They were all just really great nurses. So another thing about going into the pod, one of the pros is that you can end up making a connection with someone else who's in the pod. This really only happened to me once, but I met this girl who was about my age, and she struck up a conversation with me, and we talked for probably a solid hour and a half. We were both moms, both around the same age, both have 2 kids, and it was really nice to talk to someone like in person who's really going through a very similar experience that I was going through, especially in the middle of a pandemic. So that's one pro to a pod, is that you never know, you might make a connection with someone. And then I also just want to tell a couple funny stories about chemo. So I talk about this in a previous video that I did about my very first chemo day, and I'll put a link to that somewhere up here. But I had an infusion reaction on the very first day that I had chemo, and it ended up being totally fine. My nurses were all over it. So the first time that I was in a pod, you can't help but overhear what the nurses are saying to the other patients in your pod, because you're right there. So I overheard the nurse talking to this man, this other patient. He was across the room from me. He was elderly. He was probably in his 70s or 80s. And it was clear that this was his first time getting chemo, because she was explaining to him that he may get an infusion reaction and what to expect. So he was listening and I was listening. Once I picked up on the fact that it was probably his first chemo treatment, I couldn't not do it. I was on high alert and I kept looking over at him, and thankfully he was very into this book that he was reading. So thankfully he wasn't looking at me while I was looking at him, because that would have been really awkward, but I couldn't take my eyes off him because I was so worried that he was going to have an infusion reaction. So the nurse said, okay, here we go. He was starting to get the chemo. He was cool as a cucumber, and I was like on edge. I was like making sure I knew where my call button was. I was looking at him, looking for any signs of him having a reaction, and it turned out that he was totally fine. I wasn't sure that he was going to have a reaction, but I was sure that if he was going to, I was going to be on top of it. So that's just my first experience in a pod. So another experience that I had was, I decided that when I was getting chemo, on those days, I wanted to dedicate that time to editing my YouTube videos. So I bought the AirPods, the wireless earpods. And I was so excited I was going to be able to work on editing my videos, and especially if I was going to be in a pod where there would be other chemo patients there, I would be able to edit my videos and not feel guilty that I was making everyone else listen to it. So it was the first time that I went in to get chemo with my AirPods, and I put them in, I opened up my laptop, I start editing, and I kind of thought like, oh, this is kind of weird, it's not that loud. But I'd never used AirPods before, so I just turned the volume all the way up on my laptop, and then I could hear it, and then I just kind of kept going on with editing. And there were 2 nurses in that pod that day. So at one point, my nurse came up to me to, I don't know, fix my IV or something, and she asked me, is that you in that video? And I said, yeah, and she said, oh, that's really cool, and she said, it's really relatable what you're saying, and I was like, oh, thank you. And then I was like, wait, how did she know that that's relatable? And so I was like, wait, how do you know? And she was like, oh, I've been listening. And then the second nurse in my pod, who was like across the room with another patient, said, yeah, I've been listening to you. And then I realized that I had not registered my AirPods with my laptop. So I had my laptop on full blast for the entire pod to listen to, and I had no clue. So the nurses were listening in, the other patients could probably hear. It was a show for the whole room to listen in on. So then I realized there's an actual process that you have to go through to register the AirPods with your laptop, which of course was super easy and took like 4 seconds, but I didn't realize that. I thought I could just put them in my ears, they'd be working, we'd be one and done. But yeah, so the whole place was listening in on my YouTube videos. And another story is I was again sitting in a pod, and there was a woman who was across the room from me who actually was having an infusion reaction. So the good thing is that she was fine. The nurses took really good care of her and she was fine. She got squared away. But the timing of when that started was about half an hour after I was given my Benadryl. So the call light button tone is going off. Nurses are flooding into the room. This part of it is not funny. She was having a reaction. I couldn't really see her because there were so many nurses that were surrounding her. So my eyelids were really heavy. I was getting really tired, but I just kept thinking, don't be a jerk. Don't fall asleep while this poor woman is having a reaction right now. And then I was thinking, well, what am I gonna do anyway? Like, I can't do anything. That's why the nurses are here. That's the nurse's job. What are you gonna do? But then I was thinking, oh my God, you're gonna look so insensitive. This woman is right across the room from you and you're gonna fall asleep. So I was having this internal dialogue all while trying not to fall asleep. And I just kept thinking, don't be a jerk, don't be a jerk, don't be a jerk. And then I could feel myself falling asleep. And then I remember thinking, okay, you're a jerk, and dozing off. But I just thought my whole internal dialogue and internal conflict was a little bit funny, so. But yeah, that's what it's like getting chemo, and if anyone is watching who is about to start getting chemo, if you have any questions, just leave a comment below and I'll do my best to answer any of your questions, and I will talk to you in the next one. Bye.